Welcome to Behind the Scrub, the podcast where we talk about the real life of nursing students, the struggle, the laughter, and the real story, and everything in between. I remain your humble host, Anima Shankadija, and here with me is.
Miss Evelyn, and thank you for having me on your show.
Thank you for honoring our invitation, Miss Evelyn.
Mm,
Could you like to tell us what influenced your decision in choosing nursing as a career?
It's the money, but again, I'm passionate about people and health in general.
Oh, that's
Yes.
nice. So, for humanity.
Yeah, let's.
Today's discussion, I would like you to educate us on sexual and reproductive health, Miss Evelyn.
Okay. Before I begin, I would like to acknowledge the topic sexual and reproductive health because most times it's usually uncomfortable to talk about it in public. As a healthcare provider in training,
Mhm.
I have seen situations where lack of knowledge leads to death or sickness, and while knowledge actually leads to life. So, in building a community, it starts with having individuals who are able to make decisions, powerful decisions about their reproductive and sexual health. To begin with the definitions of sexual health and reproductive health. Sexual health is basically talking about having a positive and respectful attitude towards our sexuality and our sexual health, making informed decision, making sure there are safe pregnancy if planned, and also just in general our sexual health. Then reproductive health is essential because it talks about the reproductive system functioning. It talks about the capability of being able to produce when, how, and if you actually want to produce it. Moving on, I'll be talking about the components that actually makes up the sexual and reproductive health. I actually call them the four pillars, which are family planning, prevention of sexually transmitted diseases, maternal health, and also access to reproductive health care services. Starting with family planning, it involves using of different methods such as injections, oral contraceptives, implants to prevent unwanted pregnancies, and also it helps in the protection of the maternal and also the child health. Moving on is prevention of STD. If you actually know how these STIs are actually transmitted, you'll be able to prevent them. For example, STI can actually be transmitted via unprotected sex, which can be orally, vaginally, or even anally. This all can actually cause STIs, such as chlamydia, HIV, and so many others. So, moving on, access to reproductive health services help people to make informed decision and also help them to get help they need from clinics, professional guidance, and counseling. Maternal health, it includes safe pregnancy, safe delivery, a mother attending antenatal classes to prevent complications in pregnancy and for safe maternal and also the child's health. Moving on is the importance of sexual and reproductive health. One, it helps in preventing sexually transmitted diseases such as HIV, gonorrhea, chlamydia. If we know how these diseases are actually transmitted, it can help in the prevention of them. Creating an awareness about sexual and reproductive health is actually very important because it prevents teenage pregnancies, it prevents abortion, it promotes early health seeking behavior, and basically protects the health of everyone in the community and in society.
Thank you, Miss Evelyn, for the wonderful health talk. Well, please, can you tell us one popular misconception of sexual and reproductive health?
Okay, so one very popular one I know is that it's the mother that actually determines the sex of the child, which is very, very
Okay.
wrong. It's not. It's actually the father. Yes. So if you don't know today, let me tell you, it's actually the father that determines the sex of the child. So to further buttress my point, we all have chromosomes. Yes. So the female have the XX chromosome, while the male have the XY chromosome.
Mhm.
During reproduction and formation of a zygote, the father will either drop X or he will drop Y. If he drops X, it will go and form with one of the mother's X, making a girl. And if he drops the Y chromosome, it's going to form with one of the mother's X chromosome again to give a male child. So, men, you are the determinant of the sex of
You
the
hear
male.
that? Thank you for the wonderful insight on this discussion, Miss Evelyn. And I hope you've all learned one or two things from the reproductive health. Thank you. And it's a wrap for today's episode of Behind the Scrub. Thank you for listening, learning, and laughing with us. And don't forget, behind every pair of scrub is a story worth telling. Thank you.